talk about becoming Good.
Okay.
You're probably loud enough.
Yeah. Okay, it's 7:00. We're going to start this meeting. Would everyone please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Let me start my thing. We'll do the minutes.
Go ahead with that. Now we'll
Okay.
do the minutes afterwards. Yeah, because then we can just do all our stuff.
All right. All right. Hello. I mean, I'm loud.
Testing.
Right? Probably loud enough for me. All right. Hello, everyone. Just a few instructions for tonight. There's a microphone up here at the front, and so for the members of the HDAC, as you're talking and voting, please look into that mic and talk to that mic. We're not looking at the camera. We're not looking where else. That'll make sure we pick up your audio for the live stream. And so for those who don't know, the meeting is being live streamed by the ADP team on YouTube, and that will be, it's under Health District Advisory Council is the title of the video. Please put your phones on silent. That was ironic timing. Thank you, Mike, for that reminder. Put your phones on silent. And then for those that will be coming up here to speak, which will be, we're gonna do all of our speaking from this podium. So not only the candidates, but also members of the public, if you want to comment. Everything will be up here with the exception of the HDAC members. You guys will speak and talk from your seats. If you're talking to the team up here. The microphone up here, we'll leave on, or I'll switch it on and off to help you out. We'll get you on that. The only speaking that we're trying to do from the people being interviewed, the positions, and from the public will be up here. And that's just, and that's just to avoid having the camera pan back and forth all night long for the live streams. We're gonna try to keep it somewhat center focused. If anyone needs to get food after the meeting starts, please walk out and around. We'll prop this door open. Then we're not walking in front of the camera, the live stream the whole night. The candidates who will be speaking, there were 6, there's 5 that'll be here tonight. Those members get 6 minutes each. We'll have a timer up on the screen, so it's fair for everybody. Get your 6 minutes. There then can be up to 3 Q&As from the HDAC members, so the members that are at the tables. Mr. Sutter or Mr. Brown will call upon you for that for the 3 questions. After the candidates speak, after the Q&A of each one of them, we'll then have 2 minutes per person to comment from the public. So we'll do that after everything else is done, so it's all in order. And then we'll go to a vote. The one thing I asked Mr. Sutter if I could do was kind of give an update to where the health department's at, and that's for those who have not been able to attend the quarterly HDAC meetings. Because I had some questions recently from some different people, and it kind of was stuff we covered at the quarterly HDAC. But I figured now is a good time to kind of give you guys that update. So, and I'm going to try to read it from here so I stay on topic, because otherwise I'll talk too long. You guys aren't going to be happy with that. Neither will Mr. Sutter or Mr. Brown. So, keep on topic. So, that would also be putting your phone on mute. I'm going to play that Frankie as a new for all of you. I'm waiting here. I stand before you to deliver an update, but to share testament to the dedication, resilience, and unwavering commitment of the Geauga Public Health team. We're not just an agency, but we're also a force in the cornerstone of the community, and we're proud to share you with an update for Geauga Public Health. So let's begin with the numbers. In 2026, we expect nearly 60% of our revenue, excluding transfers in and out, to be generated by our environmental health division. This encompasses the essential work of food establishment inspections, septic installation permits, plumbing permits, and crucial operation maintenance program. While our local levy fund provides approximately 19% of the revenue, we are also a complex organization supported by state, federal, and other local sources. Numbers alone don't capture the heart of the work the team does here. What truly defines us is the commitment to the serving of people in Geauga County, and the commitment is exemplified in the innovative program that Mr. Lark and his team in environmental health are putting together in conjunction with the Geauga County Prosecutor's Office. And for those of you who probably know and don't love the Operation Maintenance Program, which none of us do either, that's a state mandated program there's no funding for. What we're looking to do is for that program, any excess revenue that we bring in, so if revenues are higher than expected for the year, we're working on a program where we can actually return those dollars back to the public for those in need. Maybe they'll meet different financial criteria, and we're working that with the prosecutor's office so if the money goes back to the public, it doesn't stay with the health department itself. We're viewing it as a fiscal responsibility. It's a compassionate government in action. Furthermore, we're proud. We put our hearts into rebuilding and strengthening our relationship with our Amish brothers and sisters. Just last night, or 2 nights ago, we were at the meet and greet that Mr. Tiber, which he's somewhere out here. Right here. There's Jonathan. Jonathan put together for some of the Clarendon Amish families. We were out there. The engineer's office, the sheriff's office,
University Hospital.
Jonathan Segoo was out there. The Chardon fire team was out there.
Yep. And Burton Fire Team.
And then Clarendon Village as well.
Yep.
That went very well, and we were able to really explain some of the programs and how they work to our Amish neighbors, specifically the ones in Clarendon. We also reach out through other means as well, such as our dedicated public health nurse, Melissa Kimbrough, who's fostering trust and providing vital information about vaccinations and other things to our Amish neighbors who may not have access to either Facebook or Instagram or things of that nature, where sometimes the ads come through, and where we're actually going to post our updates as to what the health department is doing. Every member of the team is a vital thread in the fabric of Geauga Public Health. Ella Orgazos, our health educator, is breathing new life into the community outreach with engaging content and impactful grant initiatives. Lydia Kasner, our emergency preparedness leader, ensures our county is ready for any challenges. She works with our EMA, our Emergency Management Association, along with state and federal guidance to help prepare for nuclear plant issues, chemical spills, things of that nature. And then our vital staff department under Ms. Parker, including Ms. Kelly and Ms. Bushak, who deliver exceptional service when it comes to your birth, death, and burial permits as well. And the backbone, again, as I mentioned, is our environmental health team led by Mr. Lark. We're here. Wait times, as you probably have all seen, I've heard from many of you, have plummeted. Customer satisfaction is at an all-time high from what we have seen, and our compliance with House Bill 110 has been fully restored and maintained this year, rectifying the past issue. Mr. Lark and his team, including Dan Sinclair, Dan Lockman, Katie Stromp, Christy Finkley, Ashley Winters, Valerie McCaffrey, Matthew Jerka, Brian Ning, Jesse Baca, Eric Robb, Mia Krugel, Amanda O'Brien, Gail Duncan, Jim Pullman, and Madeline Zemba are continuing to work on ensuring that the community is not only healthy, but also safe as well with different water, septic, and food inspections. Ms. Parker also helps lead the team of clerical for the health department, which is Mr. Zubik, Ms. Bednarik, and Ms. Donnelly, and are ensuring the smooth transition and paperwork process for those coming into the health department. We're also tackling the state mandated unfunded operation maintenance program with a commitment to affordability. We are proud to offer some of or the lowest fees in the state, a testament to the team's efficiency and dedication. Geauga Public Health has also taken a stance that education is going to be the primary core of the operation maintenance program. And this is why we host night meetings for the operation maintenance program to provide education. And those are scheduled primarily at night, usually at like 6, 7 o'clock at night. So people can come after work. They're not scheduled at 2 in the afternoon when people can't attend. And while not wildly popular, the core function of the operation maintenance program comes down to some things that we found in the for sale of property program that most of you are aware of. In for sale of property, when we went back and looked at the data, we had a 40% failure rate of septic systems in Geauga County when they were tested, which actually tracks the state data of 37 to 40% as well. So we were actually tracking close with that. We also, as we started doing the NPDS systems, which I'll describe in a second, we had to do 400 double inspections, and some of those were because the system itself was physically turned off. So it couldn't treat the effluent that was then putting straight sewage more or less into either streams, the ditch, or other things. So while it is frustrating to have to go through it, there is a reason for those checks and balances. As a point of reference, the NPDS it stands for National Pollutant Discharge Elimination System, and it's regulated under the Clean Water Act. In Ohio, those permits are issued by the Ohio Environmental Protection Agency, and these systems treat effluent and then discharge it into a stream, ditch, or other surface water source. I've said this probably a million times, but I believe it's small, efficient, and effective government, and that's why what we've done here to build the Geauga Public Health. The team takes deep care for our county, and their primary goal is to make it a better place. We operate under a clear ethos that the public comes first, and that every decision we make must be legal, ethical, and moral. If it doesn't meet those 3 pillars, we just don't do it. And we're committed to serving our Geauga County with integrity, compassion, and excellence, and we work continuously and tirelessly to ensure that Geauga is a thriving county and a healthy county for all. Again, that's most of the information that you guys have gotten through our quarterly meetings, but I want to give you guys an update that because there were some questions even recently about what is it? What is our O&M program? What does it do? Why do we have it? Nothing is failing, so we don't need it. Those types of questions. So I wanted to give you guys some of that information and do it relatively quickly so that we can get into the meat and the bones of the meeting. So I'll hand it back to Mr. Sutter, Mr. Brown. Thank you.
Thank you, Adam, for the update. Okay, so the very first order of business is approval for the minutes for the meeting from March 13th, 2024. If you are going to make a motion to approve or second, please state your name and where you're from.
Bill Shamrock. Motion to accept.
Do I have a second on that motion?
Second, Tricia Combs, Montville.
And if everybody can speak as loudly as possible, I know I'm loud, but they're trying to hear us in the back as well. So
Call for a vote. All those in favor?
Aye.
All those opposed? First approval of minutes passes. Second order of business will be the approval for the special meeting, June 26th of 2024. Do I have a motion to approve those minutes?
Motion, Jonathan Tyler, Clarendon.
And a second on the floor?
Bill Shamrock.
All those in favor? Aye.
Aye.
Any opposed? Motion passes. Okay, so next we are going to move into the introduction of candidates, and I want to make special announcement and thank you to the screening committee, which consisted of Mayor Ruth Spanos, Mayor Christopher Grau, I'm sorry, County Commissioner Jim Dvorak, Tricia Combs, trustee Ken Radke, trustee, and myself, trustee. I'm going to take a minute to explain the process so everyone understands. During the screening committee, we meet to make a recommendation to the board for candidates for the health district. The way we conducted this screening was there were 6 people that were interviewed. They all sat in on each other's interview. It was one big open interview. Each person had 6 minutes to present to the board. Then it was followed up with questions from the board. And then basically we made our recommendation after that process. Since that time, we have one candidate who could not make it tonight, which was mentioned. They are still in the running, but cannot represent themselves at this meeting. So at this time, we have two candidates for the 2-year, 2 candidates for the 5-year, and 1 candidate for either or. So at this time, I'm going to go in alphabetical order, the same process we did at the screening committee. I will invite Mr. Matt Brakey up to give the introduction.
Good evening. The other candidates that are applying here tonight, they're going to be applying for the 2-year term or the 5-year term or I. I'm not applying for a term of years. I'm applying to fill my wife, Carolyn Brakey's unexpired seat and the commitment our family made to Geauga County. Carolyn and I like to joke that she helped make Geauga Public Health boring. A department that was once a lightning rod is now an afterthought, exactly as it should be. The policies that disrupted lives are, at least for now, in the past. But that should not lull this council into a false sense of security. I have not asked anyone here to speak on my behalf, nor has Carolyn lobbied you for my appointment. This is not about alliances or political favors. It's about whether this board remains independent and accountable, and maintains public trust. Carolyn's work, particularly her authorship of the first school COVID guidance in Ohio, advising against compulsory masking, which decisively put an end to mask mandates in Geauga County schools, wasn't just brave and historic. It was resoundingly endorsed by Geauga County voters. Her commissioner campaign that I helped manage focused messaging on her Board of Health accomplishments. Voters responded. She earned the highest vote total of any countywide candidate last November. That kind of validation isn't an accident. The Board of Health's own bylaws are clear. Ethical public health depends on respect for personal autonomy, self-determination, privacy, and the absence of domination in all its forms. This was not language manufactured in a vacuum. It was taken verbatim from the American Public Health Association. Public trust in this board was broken in the early COVID years. Coercive guidance was imposed, ethical public health principles were ignored, and logic and reason went missing. The result, the very people this board was meant to serve were harmed, including my family. That is why residents demanded change. And that is why my family stepped forward to serve both then and now. Public health should be about informing, not imposing, communicating, not compelling. Trust is built through transparency, not through mandates or pressure campaigns. Right now, every Board of Health member comes from the healthcare industry. And I know and respect each of them. If one of tonight's appointments goes to a medical professional, that's reasonable. But a board with no independent voices, that's not balanced. You see my resume. My legal education and 2 decades of state regulatory experience bring something this board is missing and needs. What's the biggest challenge this board will face in the next 2 years? Adam already spoke to it. It's not even a healthcare issue. It's the continued rollout of the state mandated operation maintenance septic inspection program. If you have already heard complaints from residents, I assure you more are coming. I respect how GPH administration has approached the rollout, keeping fees restrained and ensuring gradual implementation. But the state design program itself is flawed. It creates a new transaction cost for responsible homeowners already maintaining their septic systems, but it does little to catch actual problem systems polluting our water. Ensuring clean drinking water is the most crucial function of Geauga public health. Indeed, modern sanitation is the greatest public health advancement in human history. The O&M program is exactly the kind of state regulatory issue where my experience is invaluable. Yet it will remain absent from this board unless I am appointed. 3 years ago, HDAC made a brave decision. You looked past the screening committee's safe recommendation and appointed my wife, Carol. You ensured independent leadership at a time when it was most needed. And the result was a restoration of public trust and accountability. And tonight you face the same choice. I am ready to build on Carolyn's accomplishments, not just to finish her term, but to bring my own leadership, independence, and experience to the challenges ahead. I ask for your support tonight to keep this board moving forward, to keep it independent, accountable, and reflective of the people it serves, and perhaps most importantly of all, to keep Geauga Public Health whole. Thank you for your consideration, and I look forward to your questions.
Any member of the HDAC committee have questions for Mr. Brakey?
I have a question.
Yes, Ms. Phillips.
You say that you disagree with the having the septic system inspection process as it is, and you acknowledge the importance of clean drinking water. Do you have a proposal that would somehow ensure that the septic systems are no longer going to be a risk for clean drinking water? Do you have an alternate proposal?
Thank you for your question, Mayor Spanos. I don't have an alternate proposal as the O&M program is state mandated and it's not something that we can work outside of. So it's a question of working within the O&M program, trying to tailor it so it's as accountable to the residents of Geauga County as possible. That would involve me working with Mr. Lickey and Mr. Lark. And as I mentioned in my comments, are already doing very commendable things to keep our fees low here and to keep, I think, the interruption to residents as minimal as possible.
Thank you.
Well,
Any further questions for Mr. Breaky? Mr. Breaky?
thank you.
Thank you. Next candidate for this term would be Ms. Lynn Roman.
Tallest candidate and shortest guy. Possibly.
Go from a tall person to a short person.
I just told Jason, I said, we may have a record for the tallest and shortest candidates after back. So.
Anyhow, and I hope you can hear me without the mic, but they tell me on the pickleball court they can hear me all the time. So anyhow, I would like to, some of you may know me from my last term and wonder why I'm running for a second term. I have really three major reasons for why I'm running. One, I do have a commitment to an interest in community service. My previous experience with the public health department, which ended last March, has given me the knowledge and the understanding and the ability to pretty much jump right back in without a learning curve. And I think that's important, especially in a 2-year term. I feel like I can jump right back in and be useful. Then I would say that when I was on the board, I believe we had some very good discussions, some very good decisions. I think the board as a whole grew in the time that I was on, from the early part of my board to the second part of the board. I think the candidates that came and the people that followed, we had very good discussions. And I think that led to some very good decisions. One of the very good decisions was the cooperative agreement between Lake County and Geauga County. It did help us. Additionally, just my work experience. I think many of you know that I've spent my entire career in healthcare. Everything from after college, I worked for ODH on a very short program called the swine flu, which some of you may remember. My first full-time job was as a public health educator in the inner city of Norwood in particular. Then I held several different positions at the 3 major hospital systems in Cleveland. At University Hospitals, I was in charge of the women's clinic and the WIC program. I then went over to Metro Health and became the administrator for the emergency department. And as probably most of you know, that has the most emergency activities at it. And then I held numerous positions at the Cleveland Clinic, which is where I was probably for the longest time. I served as administrator in 3 different divisions. I managed several people. I had to look at hiring practices. I also was accountable for millions of dollars in both operating and capital expenses. And I had to hold teams of people, including myself, responsible for the variances and why we needed to do what we needed to do. So I'm very comfortable with the money issues. Outside of direct patient care, I did, as some of you know, I spent time in a medical device company developing laparoscopy tools when laparoscopy was just on the forefront. And now today, that's the main way people get surgery. But one of the meaningful non-patient ones is I did spend my last part of my career at Anthem putting up the telehealth program, of which I spent 3 years working with a software vendor in Boston. We put it together, we put it on the market, and it grew. But as all of us know, telehealth did not grow until COVID came, and now telehealth is pretty much a norm in many of the ways we provide care. And I do think there's a way we can do public health. I just haven't figured it out. I will just say Some important issues that I think the public health department needs to focus on is our public health initiatives. We need to make sure we can continue to provide vaccines and care for the underserved and for the Amish populations, et cetera. And I have a great deal of concern over the Kennedy administration and whether or not there will be public health in the future. I hope we don't have to worry about that, but I am concerned. I do think we need to continue our O&M program rollout without a doubt. And the next two kind of go together. I do think we have to brace potentially for more grant and funding, could change a lot under the new administration. And that is a concern of mine. And then I'll put this out. It's not the most friendly topic, but I think we need to realize that the levy that we voted for to support the public health department is 20 plus years old. And I think we all know that levy has a very small amount of money. And when I came to the public health department, there was in the neighborhood of about 35 people that served in the public health department. And my last knowledge was we're somewhere right under 20 now. And that's because of expenses. And that was one of the reasons we did the cooperative. So I guess in summary, I would say that I believe my most recent public health experience, together with my skill set and with all the board members that I have worked with in the last 5 years, we grew, I shouldn't say as if I'm still there, we grew to have very good discussions. We respected each other, and I think that's what we need. So, and we need that to be able to give Adam support as he moves through the things that need to happen here in Geauga County. So anyhow, thank you for listening, and if there's any questions, I'll try to answer them.
I got a question. Jim McCaskey, Munson Township. Lynn, like Mr. Brakey said, that the board needs to be balanced of a variety of people. Do you feel you're bringing more of a business mind or more of a health mind to the board?
I would probably say 50-50. I mean, I certainly have had the business side of it, but I can't erase the health side.
Fair enough.
Other questions? Well, thank you.
Thank you, Lynn.
Thank you very much.
At this time, Rich Dykey is the next candidate. He is for the 2-year and the 5-year, either or he is comfortable with.
Well, I was gonna be last.
Pick one or the other.
Go when you're ready, sir.
Whenever you're ready.
Ready.
Hi, my name is Rich Didkey. I'm pretty new to Geauga County, but I've lived in Northeast Ohio all my life. I've decided to make Geauga County my permanent home because I really came to like it out here. My experience is that I'm a retired bus mechanic. I worked for the Cleveland Transit Authority now it's Greater Cleveland Regional Transit Authority for 33 years. In that time, I've had a lot of OSHA training, a lot of safety training, a lot of natural gas training for safety things related to that. Some hazmat, some DOT, it was a small amount compared to everything else that's out there. A lot of personal protective equipment items. In the world of transit buses, they're a dirty vehicle, and there's a lot that you have to do to stay clean and be safe on them. And one of the things I found was quite effective was I washed my hands a lot, because when you're in a vehicle that 1 million people go in and out of every day, you want to stay clean. And as much as I saw other people sick, I rarely got sick. Whether that had anything to do with it or not, I don't know, but nonetheless. But I'd like to bring an outside position or apply for the outside position is where I don't know nobody here other than my neighbors that showed up to support me. And I have no business connections. I have no political connections. I'm a pretty good problem solver and analyzer. I mean, I worked on buses for 33 years. I figure a lot of things out, but I think I have something to offer for the health department, and it's an independent voice. And I like to look at things from several different directions. I also like to take in other people's experiences because you have to take in everyone else's experience as well. I get along with most people. I value everybody's input. And you have to, because that's what life's about, And I feel that I would be a good candidate for it. Some of the things that they do, a lot of people don't know about are the birth and the death certificates, and I've gone through a lot of that in genealogy because I have an aunt that's like our family genealogist, so she's gone into a lot of county positions looking for records, so that's pretty important for a lot of people. It's always good to know where you came from and where you were at. Something I didn't know that the county has is the proper installation of car seats. I found that to be quite interesting, amongst a lot of other things. One of the other issues, as many have brought up, are the O&M program. There's supposed to be some state laws coming out to change that. When they'll get here, who knows? But that is on the horizon. Since those are administrative rules or laws or whatever you want to define them as, they are also up for not judicial, but administrative review this year. So that too is on the horizon. And if the health departments have problems with them, they need to contact them and let them know that. And I had to do a lot of digging to find that out, but that I did find out. I think there needs to be a better relationship between the septic providers and the people in the county. And like Mr. Litke had stated, you had a lot of people that had systems they didn't even know they were turned on. How does that take effect?
Well, I'll answer after you get done. I don't want to take your time.
Okay, I'm sorry.
Yeah, I don't want to take your time.
Okay. No, but there's things like that I feel that the septic providers, and there's plenty of them here if you look on the website, that they deal with every make, manufacturer of septic system, which tells me that a lot of people out here, they take care of those things. I see Connecticut Water Company out here, which was a big business, and so you've got a lot of, so they have a lot of, water treatment systems. So there's a lot of good things in our backyard here in Geauga County. You can travel 5 miles out here to be at any store, any hospital, any doctor's office. You don't have to go too far. And I just feel there's a lot of good things out here. Some things need to be looked at. Some things could be better. Some things can always be improved upon, and they need to be looked at. And I kind of like to look at things from several different directions before I make decisions. And you always hope to make the best decision, the information you have at the time. At the last interview, the subject of COVID was brought up. And as I stated there was so much information and disinformation. How could you honestly know what to believe? I mean, it was something that shouldn't have had to happen the way that it did. I think the panic button was pushed a little too early and too quick, and a lot of people lost businesses and incomes because of it. And then turned around that the state and federal government are going to give everybody more money. Well, where do they get that from? All they do is print more of it, and it makes it worse for everybody. So I think there's some things that really need to be done in hindsight to make sure that never happens again. So with that, I got 20 seconds. I can't tell you anything more. So if you got any questions, I'm happy to answer anything I get.
Mr. Tiber?
Jonathan Tiber, Clarendon Township. Mr. McCaskey mentioned a question from the last candidate about a balance of the board. Would your focus, you are not a medical personnel.
I don't have a medical background. No. Well, other than first aid treatment, I don't have a medical background.
We see that Geauga Public Health, they cover a lot of things. Would your focus be not necessarily on the medical side of what GPH does? Because there's already medical
Well, I
personnel.
think from what I've seen of the people in the health department, you have plenty of medical people. I wouldn't see how I could contribute to I couldn't offer nothing too much as far as the medical end of it. But to look at things and look at programs, look at how they work, look at who runs them and what they consist of, and on and on and on. I'm just an independent voice. I think to weigh all that out and look at it rationally.
Thank you.
Mm-hmm. Well,
Anyone have any further questions?
Yes, how do you pronounce your last name?
Ditke,
Pardon me?
Ditke,
Ditkey, okay.
Ditke.
Real quick, Dan, just to answer Mr. Ditke's question, do you have a quantifiable, like why they were turned off or how? Was it the homeowner or was it?
And I don't have percents, but what was reported is a fair amount of them. Somebody had gone into the control panel and actually just turned the breakers off.
So, which it's about what I expected, but I didn't want to make a
Well,
blanket
at least it
statement.
was an easy fix, but still nonetheless, it's,
They were physically, the systems were physically off, so
Not
they were
treated
polluting.
well, it's,
Yeah, turning it back on, that isn't necessarily a fix.
well,
Sometimes that's what
It's
you
off,
think.
it's a working right.
well, it
Yeah.
was true. I mean, if I had a problem, it's like, okay, we got a problem here, we got to deal with it, you know? I mean, you shouldn't have to turn breakers off or something. But, yeah, but that many of them, that's where I say some of the installers need to have a better relationship with the people that
Yes.
they service their systems for, and
And some of the installers or our team might have caught that because they do have to have, those ones have to have annual service inspections. But we see weird things, say the least.
well, yeah, I can understand.
It's a
that.
tough one, but yeah.
But that's, as far as that goes, that was one of the things I've dealt with out here. So,
Well, thank you.
okay, thank you.
Thank you very much. The next two candidates are specific to the 5-year term. So Ms. Erica Cura, come up.
Oh, you're both 2 and 5?
Yeah.
You should use both 2 and 5.
Okay, well, yeah, both,
Want me to go?
both 2 or 5, that's,
I'll add you to the list for both though.
Hi, everyone. Good evening. I'm Erica Cura, and I have been a Geauga County resident my whole life. Some of you may know my mother, Christina Port. She's a trustee for Russell Township. I have a lot of background and experiences that I really think could be an asset to the board here. So just to start, I am a digital marketer. I'm a small business owner. But I also went back to school and got 2 master's degrees in public health and social work. So obviously, public health is really important to me. And the other thing I want to say too is I'm a mom, and kind of the why behind this. So my last name, I actually legally changed it to Cura. And the reason for that is it's the Latin root for curiosity. And it was something where I was looking at who am I innately as a person and what is that legacy that I want to leave. And so curiosity is something that's just innately in me. And that is something that I bring in all of what I do, and in particular, public health, social work, that type of thing. I also want to emphasize that public health is not an us versus them. I know in Geauga County, there are a lot of divides. I will say I grew up in a conservative home. I have voted Democrat. But to me, this really isn't about Democrat, Republican. It really is about the community. That is public health, community well-being. I also have a lot of different experiences that I really got to sink my teeth into, and just really understanding the human experience. So, for example, like I've been on the board of Ravenwood Health, which is right over here, for the past 7 years. So I have a real deep understanding of mental health and addiction, and even reaching out into the Amish community. I have done a lot of work with Clean Right Crisis Center, where I've actually done emergency services, being in emergency rooms while rape kits were administered on victims and just supporting them there. I've been on hotlines, hearing people from all around the world, just hearing their most difficult times of their lives and just being a support for them. I've also done work with Collaborative on Human Trafficking. Human trafficking, it exists here in Geauga County, it exists everywhere. So I bring a wealth of knowledge in that space as well. I've done a lot of work with Community Innovation Network, which is basically community building. So it's really working with different communities and different stakeholders and really focusing on authentic community engagement. I've done some research on authentic community engagement. And this really, to kind of summarize that, is it's really about building trust, instilling trust. And I think more than ever, this is a position where that needs to happen, is trust needs to be built and bridged. I also have teaching experience where I've taught business professionals and undergraduate students digital marketing courses. And the biggest thing I also want to say is that I really don't take this position lightly. I understand it has power behind it. It is a position that helps, make decisions on behalf of Geauga County and things like that. So please know that my name was changed for a reason, and I am a continuous learner. I will always listen. I love listening to people and hearing their experiences. I'm very aware of also the community health needs assessments that have been happening throughout the last several years at Geauga County. So I understand that mental health and addiction has been up there for some time. Another thing I would even add is I'm really passionate about, so there's adverse childhood experiences that children will experience that kind of help predict the onset of their lives and health, essentially. And I really am passionate about protective childhood experiences. So that is something in the name of prevention I'm also really passionate about. And, all in all, I mean, I'm sure the resumes are available somewhere, but I do bring a wealth of experience, and I just really look forward to being a steward to the Geauga Countyans here and listening and really make the best decisions and being informed in doing so. Any questions?
Any questions from the board?
Edward at Burton Township. So a lot has been said tonight about the septic systems and that type and water resources and things. How do you see the health board addressing, you mentioned drug addiction, and then also as our baby boomers continue to age, we see more and more limitations on the mental capacities of our seniors. And what impact do you think the health board should have on that?
Well, first off, I do know that there is like the aging population and understanding demographics. And something I even said in the last meeting is when it comes to looking for solutions, it's really important to speak to the people that it affects most. So I just want to make sure I understood your question, because you brought up like the septic system stuff and then aging population. Is there?
Well, what I said was there's been a lot of discussion on the septics. Right. Another item is basically the aging of our population, right, and then also the addiction problem that we have in our country.
Yeah, so I mean, with the septic system, I mean, I grew up on well water, being a Geauga County resident. My mother is also very aware of the septic issues. I mean, I'm aware of them as well. And I think that it's really just about engaging the stakeholders that, like having the right people in the right room to make the right decisions. I mean, I think when we look at issues, like when you take a community health needs assessment, for example, this was something where it involved, community residents, hospital healthcare systems, mental health, I mean, just a wide array of different organizations and entities, and took primary and secondary data. So it could be like surveying people directly or taking data from the state. And it basically kind of put all of this together to come up with a summary. And it was basically offered recommendations based on these data. So I guess with the septic issue, I mean, I know that that's been an ongoing thing. I do look forward to learning more about it. I think with the aging population, that is something I'm also aware of. I don't know if you're asking more in terms of like communication and things like that, but I will say I think it's really important to meet people where they're at. And I hope that answers your question. Like, I guess I'm just trying to make sure I'm understanding your question.
That's fine. Yeah, my point was we've heard a lot about the septics. I wasn't really interested in that. It was, should the health board be spending more time and efforts in the other areas? The septics are always going to
I
be.
see. Yeah, of course. I mean, I think public health is something that, you know, we're all experiencing it right now with air quality. You know, when we drive, you're wearing your seatbelt, that's all public health. So yeah, I think that I bring in a very fresh perspective, especially like bringing in my degrees, which I did obtain somewhat recently. And yeah, I mean, I am like a bird's eye view person. I really like to look at the big picture. And you're right, I have heard a lot about the septic stuff, but I don't know if you know, like I really didn't mention that much in my talk, but doesn't mean it's not important.
Thank you.
Any other further questions?
Thank you, Eric.
Thank you.
Thank you.
I guess at this time, the last candidate, Christine Sutter for the 5-year.
You're ready.
Yep, we're ready. Good evening. My name is Christine Sutter, and my background is mainly in women's health. I am a master's prepared registered nurse. I have worked at the same facility for over 22 years. I recently just had a anniversary, so I am dedicated to the community. I have grown up in the community, so I feel like I have a lot to offer as far as I do have a healthcare background, but I am also currently a nursing leader. I manage 45 staff members currently. I have overseen a couple of units simultaneously. When we had the closing of one unit, we were merging units. I do frequently do budgets. I direct reports to senior leadership, so I have a team that I refer to. I have experience as an instructor. I've worked for 3 different colleges. I've worked for Geauga, I've worked for Lakeland, and I've worked for Cleveland State. I did taught clinicals for upcoming nursing students. I am very proactive on educating our population and making sure that there is healthcare provided. I do talks with schools. I talk to 8th graders about healthcare. I've talked to kindergarten classes about sun safety, any sort of topic that they want to discuss. So I am a advocate on making sure we educate the population, especially the community that I live in. My experience with the septics is very old. I did work for an excavating company while I was in nursing school, so I did pull permits. I do have some exposure, but it's old information. So it would have to be brought back to light to bring something to offer to the rest. At that time, I was doing estimates, billing, pulling permits. I have worked at the birthing center, so I have dealt with the Amish community in multiple facets. I do promote new nurses coming in for internships, practicums, anything to kind of get our resources. I really want to get some of the schools enrollment back up. I know the enrollment's been low. Just recently, Lakeland had a low enrollment, so a lot of the healthcare programs are getting cut. So I think it's very important to make sure that we're educating and offering assistance to those that need it. The experience I have to offer, I currently deal with the budgets. I provide data for different boards and committees. I do work I am on different committees for the healthcare system to help improve outcomes. I review policies and guidelines and trying to implement any changes to make sure we offer consistent evidence-based practice for our community. I do quality reviews, make sure we review any situations that can be improved and make sure that we do have better outcomes. I do have a desire to influence positive changes in healthcare practices and policies, improving access, affordability, and quality. That I have interest in working with others to address health challenges in the community and create sustainable solutions. Volunteering wise, I have worked at the fair. I've offered blood pressure screenings, health education. So I do have participation with community events, health and safety days, baby community showers that we're offering. I make sure that I can offer any sort of education to the community. I have worked the vaccine clinic with the county to offer vaccines to the Amish community as a DDC. And currently I do send staff members to assist Melissa in some of the vaccine clinics because I think it's very important to promote the vaccines and make sure it's available for our community. I do work with the county as far as WIC, help me grow the Sparkler program. I promote the Dolly Parton Imagination Library, make sure that there's age appropriate books for children from ages 0 to 5 so that they get a book mailed to them. It's a nice resource that I think needs to be promoted and celebrated so we can keep these resources, this funding going and make sure that the community has all the resources they need to be successful. I also had assisted in opening our outpatient lactation clinic, and it is doing very well. It's helping breastfeeding moms so we can increase the breastfeeding rates for the community. It offers a nice local resource so they can come and help with any breastfeeding challenges, whether it's latching, if the baby's not thriving, the pediatrician can send them over to be seen by our lactation consultants, and it's a growing program and it's doing very well. So I do have connections with that and putting that together, and we're a part of Ohio First Steps, which is in educating my staff and the community so we can increase the breastfeeding rates. Oh my goodness, I got a minute left. So I have a strong passion for improving community health and well-being. I would love to be part of the decision-making body that can positively impact healthcare policies and services for all individuals. So thank you for listening to my speech.
Any questions from the members?
Well, speak up.
That was it, grand finale.
Thank you very much.
Scared them away.
Do you want to mention Ms. Brenner?
Yeah, I will make mention. The other candidate that was not able to attend was Melissa Brenner, and she was specifically for the 2-year program or 2-year role, and she was not able to make it due to illness. At this time, we should go to the public comment section of our meeting. It is open to 1 question per public.
Each member of the public will get 2 minutes. If you can, step up to the podium. That way they're not switching the camera back and forth. Just be mindful you're being live streamed, so please keep it, appropriate. And then B, just a reminder that you represent Geauga County, so do so respectfully, as I always tell everyone, even at our meetings. So whoever likes to come up.
Comment.
In the past, it was comment.
It was,
Yeah,
comment as well.
Public comment.
Yeah.
Good evening, HDEC members present, members of the community, and all of the applicants for tonight's HDEC meeting. My name is Mary Briggs. I will be brief, and those of you who know me, well, I'm sort of blunt. So I pray that you have a collective memory of what took place during the Geauga Public Health special meeting on March 15th, 2022, ahead of the HDEC meeting on that day. Dismantling of the Geauga Public Health Department as we knew it, with the Lake County contract, a 15-day notice given to our Geauga County public health employees, and in my opinion, a horrible lack of transparency on how that contract was generated, having attended each and every health meeting prior to that. So I just want to bring it to your attention. Most of you know about it because one of the two board members involved in that. One is reapplying tonight and the other spouse is applying for that 2-year position. So I thank you very much. And public health is so important to the quality of life of the citizens of Geauga County. Thank you for your public service.
Thank you, Mary.
Good evening, everybody. Everybody in this room has a very, very important role and performs very important service for our communities, except for Adam.
Love you too.
You know, as most of us in this room, I was there. A lot of you have been there over the years, and the controversy of Geauga Public Health, as it was alluded to, has gone by the wayside, and that's a very good thing. And that's based on a lot of the diligent work and the follow through from HDAC members. So different from the past, I don't have prepared fiery remarks to deliver because, you know, I'm happy to say from my point of view that Geauga Public Health has been an example of a public agency that has identified a problem, found a solution, and implemented it. There's always work to be done, and I think you know, the candidates tonight show that you have multiple good choices to choose from, and I trust each and every one of you to make the right choice in that matter. And it's nice as a member of the public, as a resident, as somebody that you know, is served by this agency like everybody else in Geauga County, that I don't have to lobby my elected officials to make a decision, because the decision, however the decision is made, it's going to be good for the county, and I appreciate that. Thank you, guys.
Thank you, Chris.
That's gross.
Maybe someone should say who he was.
Yeah.
We know.
Chris Olashef, he was formerly with Aquila Village.
Former HDAC chairman.
Yeah, big fan of mine, apparently.
Any other public comment?
And this is for speaking for the candidates as well. So just to be clear, this is the one chance for the public to speak. Bless you.
No one else? No other public comment? Well, at this time, I believe the screening committee is prepared to announce the candidates they've picked for the 2 terms that are available. So at this time, I will stand up and speak for the screening committee, which involved, like I said before, Mayor Spanos, Mayor Garau, Mr. Dvorak, Patricia Combs, Ken Radke, and myself. The screening committee for the 2-year recommendation was Lynn Roman.
And the recommendation for the 5-year program was Christina Sutter.
So at this time, we're going to do a roll call and a vote based on our list.
Mike's list should match mine order. So
So we will need you to state who you are, where you're from, and who you're voting for.
Should we do one before the other?
Yes, we're going to do the, I'm sorry.
we are
Just a
splitting.
quick-
Yeah, we should do the 2-year term first, and then we will do the 5-year. So we'll go through this twice. So Auburn Township will be the first vote for the 2-year term.
Gene McHugh, Auburn Township, and I will also vote for Lynn Roman.
Michael Bates, Auburn Town, or Bainbridge Township.
We will vote for Lynn Rowan.
Burton Township.
Burton Township will vote for Lynn Roman.
Burton Village,
Burton Village will vote for Lynn Roman.
Chardon City,
City of Chardon for Lynn Roman.
Chardon Township,
Lynn Roman.
Chester Township,
Ken Radke, Lynn Roman.
Clarendon Township,
Clarendon Township will vote for Mr. Breaky.
Geauga County Commissioner Dvorak,
Matt Breaky.
Hamden Township,
Hamden Township for Matt Breaky.
Huntsburg Township, Jason Sutter, Lynn Roman. I don't believe Middlefield Township is in attendance. I don't believe Middlefield Village is in attendance. Montville,
Montville Township for Matt Breaky.
Munson Township,
Lynn Roman.
Newberry Township,
Matt Bricky.
Parkman Township.
Lynn Roman.
I don't believe Russell Township is in attendance. I do not believe South Russell Village is in attendance. Thompson Township
Lynn Roman.
and Troy Township.
Lynn Roman.
$13 to 5, Mrs. Roman.
Okay, next we will go through the same process for the 5-year, except for I can eliminate the ones that I did not get a response from, so it should go just a little bit quicker. Auburn Township,
Gene McCune, Auburn Township. Is Matt Breaky running for the 5 too?
no.
No.
The candidates are Rich Deitke, Erica Kura, and Christine Sutter.
I'm gonna vote for Richard.
Bainbridge Township,
Bainbridge votes for Christine Sutter.
Burton Township,
Burton Township votes for Christine Sutter.
Burton Village,
Burton Village, Ruth Spanos votes for Christine Sutter.
City of Chardon,
City of Chardon, Christine Sutter.
Chardon Township,
Christine Sutter.
Chesterland Township,
Christine Sutter.
Clarendon Township,
Clarendon votes for Mr. Deitke.
Commissioners, Mr. Dvorak,
Christine Sutter.
Hamden Township,
Rich Specky.
Huntsburg Township is going to abstain from that vote. Montville Township,
Montville Township for Christine Sutter.
Munson Township,
Christine Sutter.
Newberry Township,
Richard Dyke, I can't pronounce. it.
Deitke. Parkman Township,
Christine Sutter.
Thompson Township,
Christine Sutter.
and Troy Township.
Christine Sutter.
12 to 4, Miss Sutter.
So at this time, I would like to thank all the candidates for their applications and their time put into the process. I would like to thank the HDAC members for all responding and being at the meeting tonight and voting. I would also like to make a special thanks to Dr. Rude and Ms. Carolyn Breaky in recognition of them being on the board as their terms have either expired or they've moved on.
And we did have an award for Dr. Rude, but unfortunately, not dissimilar to Mrs. Roman's, it is somewhere stuck between Amazon and my house. So he will get it at some point in the future, but I do not have anything to hand him because whatever happens to shipping nowadays happens to shipping. So But thank you, Dr. Root, for everything. Yeah.
Thank you, thank you. At this time, this is my favorite time. I will entertain if anyone would like to be a HDAC chairman or a secretary, if we have any nominations for these two positions.
The gyms aren't raising their hand.
Everybody.
We can nominate other people, you know?
Well, I'm willing to continue on if I have a vote. Unanimous consent.
I nominate Jason Sutter for president.
I second Jason.
I move we close the nomination.
Mike Brown, Jim McCaskey. Okay, call for a vote. All those in favor? Aye.
Aye.
I could speak for myself, but not for Mr. Michael Brown.
I move to nominate Michael Brown as secretary.
Thank you, Mr. McCaskey.
I'll second it.
Sharon Sim.
Just do a good job.
You know, you can reject a vote and say nay.
Let's call for a vote. All those in favor? Aye.
Aye.
Any opposed? Nay.
Thanks, I guess.
The ayes have it. Thank you, Michael Brown. I appreciate that. All right, now everyone's favorite time of the meeting. Motion to adjourn.
Real quick, hold on. Cause I just have to show you guys the budget. You guys have to vote on it, but I do have to show it real quick. So, and it's late, so I'm not gonna go into any of the other stuff we usually go about with what's going on. So the budget, I think everyone can see it. It's not super.
That's what I said.
The revenue is super conservative and expenses are conservative because right now, you know, cars, most of you all hire and fire people and buy vehicles and whatnot. Cars are astronomical right now. They're like $30,000 for 4-wheel drive. Personnel is not getting cheaper. We also have, as probably some of you heard, OPERS is looking at maybe increasing the contribution rate that we all pay. This doesn't include that OPERS stuff, but expenses are going up. As one of the candidates mentioned, the levy's not going to last forever. I'm doing the best to make it last for the 5 years it's currently up for. But understand that we are, just as probably the rest of you are, in a very tight spot when it comes to a lot of the cash inflow and outflow. O&M is somewhat of a estimate on this because again, this is 2026 budget. So we'll redo this in November, December when we have accurate information. We don't know where grants are going right now because as you guys have all probably seen, there's cutting, are we going to have a grant, not have a grant? The operation and maintenance program is one of the largest revenue sources, but it's one of the largest expenses because almost every dollar that goes into a person to do the inspection. Those people all require a vehicle. They all require computers. They all require monitors. They all require tablets when they're out in the field for the software that they run. Those are incredibly expensive. We just updated the computers and whatnot, and that was an astronomical undertaking. Also, the software program health departments have used for, I'm going to guess, Ron can correct me, but I want to say since the 90s is on its way out, and new software has to be purchased. That is not cheap either, because it's been a program that really doesn't function that well in the first place. We've had it for a long time. So again, we're doing the best we can to control expenses, but please understand, just like all of you are facing, we're facing a point that is a tougher outcome. And the reality is, when we did a lot of this, when I first started talking to most of you, 5, 6, 7, actually it was probably 7 or 8 years ago for most of you, we had another $1 million in reserves that went out to pay the House Bill 110 inspections that were never done, but were charged for. That dropped our cash carryover by $1 million. Not to mention the time to go do that stuff, the legal costs that were impacted to figure all that out. So again, we are doing the best we can, but understand, you know, in the next 2-3 years, we are going to have to increase the levy at some point or find other alternate revenue sources. I say it every time up here, I'm a small government person, but the reality is I can only get blood from a stone for so long. Eventually there's no blood left in the stone. So we're doing the best we can. I'll keep you guys updated. If you come to the quarterly HDAC meetings, we generally talk about some stuff like this, revenue sources and whatnot. Again, the operation maintenance program, I don't know where that's going because again, one thing that we do have to account for is if the non-compliance rate, if someone doesn't pay, it goes onto their taxes, we get a year later. So I may be accounting for it this year, but if they don't pay it, I don't get it until a year later. So we're a year behind on some of those expenses as well, or sorry, revenue sources, not expenses, revenue sources. So again, I just want to give you guys an update. This is not like the sky is falling. It's not to scare anybody. I just want to make sure you guys understand, because I think at the quarterly HDAC that was brought up, we love that you're mostly positive about everything, but don't shy away from if you see there's something on the wall 5 years from now, 2 years from now, and there is something, just like all of you are dealing with, we're dealing with the exact same issue. And obviously I want to maintain staffing. We've had almost zero turnover in general, besides someone taking a position that was just closer to home. And, that's a testament to the things we're trying to do here. But again, everything has a cost when it comes down to it. So anyways, I appreciate it. And I appreciate all of your guys' time. Sorry.
So just one quick question. Do you do like a 5-year projection so that you can anticipate when you see that need, so you can start a year or two earlier in trying to communicate the message to people?
Yes. So we did that, and we did it before the House Bill 110 issue. And at that point, I was more than confident that we could weather any storm. After the House Bill 110 issue of $1 million, I'm still confident that GPH will do its job and will be able to do it. The reality is it's not a 5-year anymore. It's a 2 or 3 year, and then looking at what are the revenue sources we have. The vehicles and the staffing are obviously 2 of our biggest expenses, because every person here has to have a vehicle when they do their inspections. And it's a great team here at GPH. I mean, I think most of you guys have seen that. I think I asked some of you when I do see you, complaints are generally down. Positive comments are up. Wait times are significantly down due to Mr. Lark's team. We met with the Amish 2 days ago to Mr. Tiber, and they said the same thing. They're seeing significantly faster response times in the past 2 years. So again, we're doing that, but there are things that come at a cost with that. So yeah, we do a 5-year. The biggest thing right now is what is going to happen to the federal and state government and OBRS. OBRS would be catastrophic. But the federal and state government, whatever they decide to do, and I'm sure you're all in the same boat, preaching to the choir. It's just a reality of what we're looking at. And I can't account for everything, but I think we're good until the next levy comes up. And at that point, I'm going to hope I have your guys' support that we're going to look for something else. I don't know what that number is yet. I don't want to throw a number out there without doing due diligence and talking to Mr. Walder's team. But we are at that point in this next levy cycle. And that'd be, I think, 20 years that levy would have been in place at that point. So, but that's it. I'm not going to bore you guys with the rest of the slides. I just want to make sure you guys see this, because that's important. And I'm sure the quarterly HDAC would have my caboose if I didn't tell you about it. So save my own self there.
Sir, when is the next quarterly meeting?
We're thinking sometime in June should be the next quarterly, but we're gonna try and line that up based on summer vacations and those type of things. So we'll see what attendance would what date and attendance would make the most sense.
I do buy pizza. We've never had a quorum. I buy pizza though. So if you want to come, get a quorum and have pizza.
Absolutely. So at this point of the meeting, I would entertain a motion to adjourn.
So moved.
Hold on.
It's like you guys want to get out of here.
Who seconded?
Ken Burnett.
Ken Burnett. Call for a vote. All those in favor? Any opposed?
Yeah, really. You guys got.
Thank you, Jason.
You got-